Hi, welcome to Environment and Pet Therapy as an Influence on the Treatment of Tourette's. This presentation will be done by Mindy Meyer, who is a certified pediatric nurse practitioner and is also CBIT certified. Dr. Ann Weller will also be presenting. She is a pediatric psychologist who runs the practice that Mindy works out of. I am going to start the presentation with a brief intro. Some of the kids just saying hi and making silly faces. The little boy at the end is not ticking. He's just being silly and doesn't know what to say. All right.
Hey, what up? Hi, world.
Yeah, say what you want. Tourette's is awesome.
Are you crazy?
Am I crazy?
Jeez. That is so me.
What is CBIT? So I'm going to assume that most of you watching this know what CBIT is, Comprehensive Behavioral Intervention for Ticks. But there's a lot of times I hear from patients that they've been trying to figure out what to do to help their ticks for years and have not heard of it. But the Tourette Association of America has a lot on this, so I'm just going to be brief on what CBIT is in and of itself. So it's a few things, three basic things. Number one, it's teaching the patient child to be aware of his or her ticks and the urge to tick. The urge is the feeling that you have before you actually do the tick. It can be an itch, it can be a pressure, discomfort, incomplete feeling, just to name a few. And so they have to be aware so they can be able to put in a response to help prevent the tick. Then the main part is training the patient to do a competing behavior when they feel the urge. There are three components to that. Whatever they choose to do and the provider helps them choose to do should make it impossible to do the tick, should be less noticeable than the tick, and should be able to be done while doing anything that a child or adult of their age would be doing anyway. And then the final component of CBIT is making changes to day-to-day activities in ways that can be helpful in reducing ticks. So if you know, for example, eye ticks, sometimes if the kid's always going up to the right, if I have them make them sit in places where they have to look slightly to the left, it will reduce that tick. Things of that nature. And if we can reduce triggers, that's helpful. And that's kind of what that part is. So the next set of videos is a bunch of different kids explaining what CBIT is to them. And I think they explain it better than I ever could. Thank you.
CBIT is a therapy for tics and Tourette syndrome. Usually people with tics and Tourette syndrome come here and they learn how to cope with their tics.
What kind of things do you learn to do that help you cope?
So usually I had this tic where I used to, like that, and I tilted my head to the side a little, so people wouldn't notice me doing it much. I also used to keep my hands on a surface like a table or my lap or something because I had a tic. I have a tic currently and another one in the past. It was about I was picking my head and also I bite my nails a lot. For vocal tics, sometimes I just keep my mouth closed, so it's not as loud. When I feel the urge for the tics in general,
Uh, Basically, it helps you work on your ticks and come up with responses so that you can basically stop your ticks.
I found out about CBIT because my daughter was having some pretty large, significant tics, and we went to see her neurologist to discuss medication because I thought that was our only choice. and he presented some research about CBIT and referred us to a CBIT specialist, and we have been with her ever since.
CBIT is a place where you go and see how to help your disabilities, like Tourette's syndrome, which I have, and Miss Mindy helps us with that and finds ways to make us stop doing it. And when we're all done with it, we're just normal kids. It helps me with my tics, so I can just pretty much vanish them.
So, for example, with my tics, I used to bite the inside of my cheek, and it would cause me pain. So, a competing response for that was maybe holding my teeth down together and then playing a game and trying to distract myself from it. So then it kind of eases away and trains your brain to just think away from it.
I felt the urge, which is pressure in my mouth pushing out. I kept my mouth shut, and then I didn't have the urge to do it anymore since the urge has passed after an amount of time.
Developed a response to my tick. No. I learned how to spot the tick, and then I learned how to respond to the ticks that could not happen. Then I used the response whenever I felt into the tick.
We try and find something that would do something instead of the tick that wouldn't turn into a tick. Like what I did is breathing like this. And then it just kind of helped divert the urge to do them.
We chose to seek treatment because it got to the point where we didn't know how to help him. And we knew that something was going on. We didn't necessarily know what it was or how to classify it, but we knew that these movements and these mannerisms were so bad that we needed to seek help and figure out what exactly was going on with him. And we didn't want to go down the medication route because he had been on so many medications as a baby and had been through so many ADHD medications that hadn't been helpful and hadn't brought the best out in him, that we wanted to seek alternative means to give him support.
And the drum and stuff.
You go in every now and then, and they teach you strategies how to be aware of your tics, and then once you know the awareness, how to prevent it.
From Caden's neurologist, I kept on calling them during when there was a lockdown. It was COVID, and I was desperate, trying to get more medication, and then they finally told me that there is a special therapy that he can try. And I looked online, and that's how we found out about CBIT.
Yeah, then what? Talk to me. Really? Tell the story. Whoa. So, as you can see, the kids explain it better than I ever could. So next I want to talk about what, quote, typical Tourette's is and if it really exists. So the criteria for the diagnosis of Tourette's is 2 or more motor tics and 1 vocal tic for more than 1 year with no breaks of having no tics longer than 3 months and onset before age 18. That is the criteria. Nothing more, nothing less. However, where I tend to say there is no such thing as typical Tourette's is the next point. 85% of kids with Tourette's have another comorbid condition. In my practice, I see 35 kids a week on average with Tourette's or another tic disorder, and none of them are alike. So these numbers, you can see the different percentiles of kiddos with things that go with their Tourette's. All of us have seen the Tourette's iceberg. Most of these are in there. The numbers are quite high, up to 58% with ADHD, same with OCD, learning disabilities, anxiety. The rage attacks really range. That's a big range they gave. But I would say even if they don't have rage attacks, they have tic attacks, which for the kiddos, they explained is very different. It's kind of all of their tics coming at them at once. Really hard to implement one competing response that CBIT teaches when you have, your tics kind of all going at once. And then Depression window is pretty big there too. I see that more in my older patients. Sleep issues, sleep onset issues, I see quite a bit. So no two patients are the same because they could have none of these. They could have all of these issues. So it's very important to realize that there's none the same. So that being said, my hypothesis and my statement is there's no such thing as typical Tourette's. The next set of videos, the many faces of Tourette's, is a group of my patients explaining what it's like for them with their Tourette's, and each of them shares some different characteristics that stand out to them.
After a while, it can be hard, but sometimes like after a while, it's kind of like almost like as if something you get a little used to.
My Tourette's is a lot of focal tics. Yeah, I think it does make my life different because I kind of have trouble talking to people because I'm nervous. I have trouble making friends, and people notice. Sometimes people notice that I'm making noises and stuff.
And not many people have Tourette's. It's a very unique thing, and we can also call it tics. And when I was little, I was in the hospital because we didn't know what it was, and the whole entire tic that I did with my body was just this, and I just found out when I was little that it was a tic.
I was pushing my stomach like this, and I would like do this and like do, and like it just, I didn't know how to control them.
I think people might see that person like different or weird in some kind of bad way, but then once you get to know them, you realize that it's not a big deal. It's just something that the person does.
It's tic is an action where you don't have to do it. It's not required for anything, but you feel like you really, really want to do it. You have to do it.
How does it feel to try to stop a tic?
It feels like it's kind of like trying to hold back like a sneeze almost. It's like you can hold it back for a little while, but it's kind of inevitable.
Why I come here? Because I got like something like kind of like that. And some people think that I'm sick, and I'm like, dude, I don't think I'm sick.
As you can see from the videos of these awesome kids, none of them look the same, just like I said. And so typical CBIT is designed, if you read kind of the treatment outline, to be a 10-week process. But atypical CBIT, what that I do, is based on the same core principles of taking advantage of brain plasticity and habit reversal. But it builds in having an environment and space that works well for treating Tourette's, and then the kids bringing it into the real world. My previous experience had been working in a hospital setting in an outpatient clinic. I was there for 10 years, and now I've had this current space, which you'll get to see and hear about soon from Ann Weller. And I've been at this space about a year, so we will share about the space and why it matters, and then I will share directly what that looks like for CBIT.
Environmental psychology tells us that people are influenced by the external world. We all know a walk outside is effective in uplifting mood, for example. Human-built surroundings also affect how people think, feel, and behave. We know that our inhabited spaces generate a spectrum of feelings and habits. A room's lighting, colors, configuration, scale, proportion, acoustics, and materials bring up different emotions and even behaviors. With regard to psychiatric patient care, and particularly with pediatrics, we know that sensory experiences profoundly affect treatment effectiveness. For many of our kids, things can be too bright, too scratchy, too loud, too cold or warm, and visually distracting or disorienting. A clinic's design is integral to a child's progress in treatment. We've designed our clinic with classic art and whimsical designs. We use twinkle lights, wall stickers, kid-size furniture, and fantastical pieces, such as industrial and steampunk lamps and wall decor. We combine spaces that not only look, but also make people feel good. Workspaces for parents mean that parents stay instead of just dropping their kids off. We can pull parents into sessions as needed. In fact, we catch patients napping all the time. They even meditate. When kids are here for long days of psychological testing, we order Jimmy John's and they relax in the lounge. They hug the bear on the way up the stairs and run in the hallway to get energy out. They pet dogs, play with toys, and can be busily occupied while adults and doctors talk about boring stuff. The space feels homey. Kids ask to take their shoes off. The answer is yes, but if your feet stink, back on they go. Kids ask us, "Is this your house? Where's your bathtub? Where's the kitchen?" Parents ask us for design tips. Most importantly, we wanted to design spaces that show our patients we care about them. We buy pricey soap and pricey coffee, and we use real towels in the bathroom. We keep the crayons fresh and sharp. We use Pottery Barn, Crate and Barrel, and other high-end design pieces, which make our scattered Amazon purchase feel high quality too. When kids and families feel welcomed, respected, cozy, and cared for, they do better in treatment. They're more relaxed and cheerful.
So, what is what I'm calling atypical CBIT? I was trained by the Tourette Association at one of their CBIT programs. And it was presented as a 10-week course, very well outlined. Works, I did that for a long time. Quickly learned I needed about 20 weeks, and now do a very flexible schedule. So I think most practitioners out there probably fall in that category of adapting a very good, well-studied approach and made it their own. What I have considered Mindy's atypical CBIT is been the importance of building in real life activities. So one of those things is Ivy. That is my little pup, Ivy Joy. She is a service dog. The kids play with her. She's trained to play Uno and what'd she do? Tic-tac-toe. She's pretty good at Candyland and pretty good at just being a fun puppy. And then I have another one that is just that, only a puppy. But the kids really enjoy the dogs. They have become a huge part of the practice. The kids run in to see them, but it's really fun to see them look at the dogs as their treatment provider. The dog took me to the park. Ivy took me to the park, one kid says in the next slide of videos. It's really funny. Of course, I was there with her. But we do things like Ivy, and we play all kinds of games. We play bags. We play Rubik's Cube stuff. We have Pictionary. I don't know. I've probably got 30 games in here. Some that are independent, some that we do together. We go for walks. We go to the park. Kids will bring in their homework. We will set up the office to look like their classroom. Anything we can to make their use of competing responses or habit reversal of their tics as focused on what their life is like outside of treatment, outside of my office. So I want them to be able to walk out of here and do what we did in their day-to-day activities. And it's a really good test of, is what I'm teaching them working, and are they able to implement it while doing these various activities? And that's where environment, I have learned, is just so huge. And then when I talk about, back to Ivy, the pet therapy, I'm not saying that kids with Tourette's need a therapy dog. Some do, and that's fine. But a therapy, she is a service dog. I use her in my therapy to help kids see, like, wow, you can do this and be so absorbed, and you're still using a computer response and managing your tics well without suppressing them. You're using something instead, because as every kid will tell you, suppression doesn't feel good. And a competing response and habit reversal in general CBIT, it gets rid of the urge. The urge goes away without too much distress. So that's really where IV becomes exciting to me. I also have a location where I can go outside and do sports with some of the boys, although we had to get a Nerf football because the real football was hurting my hands. The boys are strong even when they're 8. And the other thing this environment has allowed me to do and given me the confidence to do and seeing the success in is treating kids with more comorbidities, autism, severe ADHD, or impulse control. Like, the space is meant for them to bounce around. They can bounce on a ball, they can run around. I don't really mind what they do as long as we're working on things. And that's their reality, that they always have ADHD. So I can't expect it to be I don't want it to be different in my office or this space, because that's the reality of who they are and what they're dealing with. And then bringing in autistic kids that I think most people would say, oh no, they don't have the awareness, depending on the level of autism. I've had huge success even with, level 3 autism. And then bring in the other piece I've been able to do is treat much younger children than was studied by the CBIT gurus. So I have kids as young as 4, and they do okay. I mean, they can't use complex responses, but they learn good breathing. They learn good insteads, we call them. I'm going to do this instead. It helps decrease the movement I do, usually would be their language. So I'll let the kids describe more about how the environment is different for them. Some of these kids I saw both in the hospital and here, and they talk about the difference. Some of them just talk about what they like about coming here, and we will go from there. All right. Here come the kiddos.
Some things we do in the office are we do Uno, and sometimes we play games like chess and Canoodle and a ton of other things. And we even play with the dogs that this Mindy has too.
It's very nice and colorful, and feels a little more kind of like how a doctor's office can be a little scary for some kids, and here is oh, it's fun and colors, and it's calming and more relaxing for kids.
For this setting, instead of the doctor's office for CBIT therapy, the doctor's office was very cold. There was no toys out. There was nothing. There were no activities to do. We had to be very spaced apart. And it was just not a warm and welcoming environment. Alternatively, this has been wonderful because the room is warm and inviting. There are cozy rugs and cozy furniture. We have a wonderful therapy dog here. There are lots of toys, and it is a more relaxed environment. We also have had the opportunity to implement things into the real world, replacement behaviors, so that my child can practice her replacement behaviors walking down the sidewalk or at the park. Those are definitely things that would not have happened if we were still in the doctor's office setting.
It's a bigger expand of room, and I like how there are a bunch of games over there, and we have these to play with, and you always get more and more things, and here you could have the dogs, and it's really fun. I like coming here more than a doctor's office because the doctor's office, I feel like it's more of a things for a bit more like sicknesses, for physical or things in your body like a cold, like you have something like the flu. You can go to the doctor's things, but this place is more for like a mental thing, a bit like therapy. It's more of a mind thing than like a sickness treating. It's more of like a mind treating.
And how is it coming here?
It's a lot better coming here because you're allowed to bring Ivy. You have a lot more ways to interact with people in here. You're allowed to bring a lot more stuff in here. Board games, you have a lot more space in here to spread out and do types of activities. Even going outside, it feels like, I guess you could feel like you're at home here.
I like coming here more because it feels closer and it feels more like home because we're in a room, not an actual hospital, and like on a hospital bed, and that's like, yeah.
Yeah, because sometimes doctors' offices are like, oh no, hope they don't give me any shots or anything.
Do you worry about that when you come here?
Nope.
Yeah. Good. Yeah. What's this room look like to you?
Yeah, kind of like your basic everyday living room with some cool toys and gadgets and things.
And it made me kind of not really want to do this. It made me like want to quit.
Okay. And how is this office different?
It's more colorful. It has more things to do. It's bigger, and it just feels better. Here, I want to work on it because I keep wanting to come back here. But there, I didn't really want to work on it.
Here feels more real life, more kind of realistic, instead of being in a hospital sense where it feels like a doctor's appointment. This feels more also like one-on-one, kind of more personal in a sense of knowing
this space.
Why do you like this space better than a doctor's office space?
Because a doctor's office places, they like just like need to do stuff. Like they just need to tell you, like, oh, do this, do that, and they give you like checkups and stuff, and it just makes me mad.
And what about coming here?
It's fun because I don't need to get checkups and stuff.
So that was a great job the kids did talking about what CBIT is like in the office. It's all well and good and hopefully preparing them for this, to take CBIT home. So while my kids are in treatment, I have assigned homework, like practice, noticing tics, noticing urges, using responses, having parents point out when things are missed, and when kids hear practice or homework, they kind of have a reaction, as we would expect. But I always tell them they don't have to do much. They just have to set a time that the parent's going to help them, and they're going to practice while they do life. And some of the kids can practice on their own by just being extra aware or using different apps that kind of trigger them to check in with themselves and what they're feeling internally. But they just need to do life. I don't need them to stop and have a dedicated practice time for the most part. I shouldn't say that 100% across the board. Some of the younger kids, we do have to do a dedicated, easy activity initially. And so usually I, say let's make a point to focus on 20 to 30 minutes a day. And then as the child gets usually within a week, the child is pretty good at their response. And when I say good, that usually means they're catching the urge for the tick about 80% of the time and using the response appropriately for the tick urge to go away. And once we're there, I kind of say, okay, you should be doing this all the time. And if parents see it, they should remind you. I do put a limit on the parents to not remind the kids usually more than twice an hour, unless the kid is like super gung-ho and wants to get it done. And once in a while there'll be a kid that says, no, tell me every time, because they're just super eager. And usually what I do in that situation is if the tick does slip through, I have them use the response for a minute to help that brain plasticity catch on that, oops, that's what I should have done instead. So the other big thing is anticipating high tick events. These are listed on the slide here, pretty common, well-known triggers of ticks, and every child is different. So we talk through those. I have them track high tick times, and if we find a pattern, I just say, if that's the tick that happens, then just expect it to happen and use your response during that situation. So now I am going to go to some of the kids talking about their work with Ivy. All right.
How does Ivy help you?
She helps me because she helps me calm down, and she helps me calm down, and because I really love dogs.
She's just kind of calm, and I guess petting her because she's a service dog. She's always here. She's like, I don't know. She plays with us. She played Uno with us one time. And it's kind of cool because it takes your mind off stuff, seeing a dog play a board game and do tricks that.
What did you just do with that dog? We should have
I
videotaped
played
that.
Uno with her.
And why did we do that? Why did we play Uno with Ivy? What was I trying to do?
You were trying to get me excited, so then I tick and see what it's like.
That's what I. Ivy, touch.
Ivy touch.
Oh, purple? Okay. Tell her to grab and put it in the pile.
Ivy grab.
Good
Pile.
girl.
Pile, Ivy.
Oh, such a good girl. Not quite Ivy. That's actually really funny. Not quite Ivy, right?
No.
Pinto said.
The dog.
How do you feel about the dogs being at an appointment?
So
Yeah.
good.
She likes to just cuddle with kids and.
When I first met you, Kaden, things at school were hard, right?
Ivy was just like there for me.
Yeah, how was she there for you? What she did? Do you remember what she did?
Mm-hmm.
What?
She lay against me when I was having some tick attacks.
She gave you some pressure, and how did that help you?
Yes, a lot.
Cool. Good job.
Are you cool with that hat? You like it? Do you like it? Do you want to talk about it? Ivy, talk. Ivy, talk. Oh, well, that's over. So there you got to see a little bit of what Ivy does and what Pinto can do. Hopefully he gets a little less puppyish over time, but he's my little Pinto bean. He's darling. And Ivy just kind of goes with the flow and does whatever. So anyway, I hope that those were kind of fun to watch and just to see how the kids interact and how Ivy helps them just kind of be at ease. You can just see in their demeanor. Next, I want to talk about outcomes. It's just of note for CBIT in general, like all the major Tourette syndrome associations or societies or guidelines point to CBIT as the first line intervention for individuals needing intervention for their tics. So the European, the Canadian, the American Academy of Psychiatry, American Academy of Neurology all recommend CBIT as the first line treatment. And then in a recent study just released in 2022, evaluating the kiddos who did CBIT 10 years ago. So 6 months after their treatment 10 years ago, 87% of participants post showed maintained their tick improvement. And after 11.2 years, 67% maintained a 50% improvement in ticks after only 10 weeks of CBIT. So that in and of itself is impressive. However, my goals, maybe they're lofty, but I have found them extremely obtainable. And my Yale scores, which are the same things, same measure that was used in the bigger study of the original CBIT kiddos, show that 90% of my kids achieve a 90% of improvement in ticks, and it is maintained over time. And by over time, I am talking about 6 years at this point. The goal is, of course, 100% of improvement. I do achieve this in about half my kids without having to continue seeing them past probably 4 to 6 months. The second goal that I have is that they can do CBIT on their own without really me there to guide them by the end of treatment. I would say this is achieved only with the older kids. Otherwise, the parents are reaching this goal, and it's kind of where they can at least get started with noticing the urge, recognizing the tick, maybe coming up with their own competing response. Once in a while, I run into a kid who just needs to see me once because they can't figure out a good competing response, and then on they go, and then I see them a couple years later, and they just maintain their tics that way. It's not that their Tourette's or tics are gone, it's that they're able to manage them on their own by the end of treatment. And they come for a short time, they come with a response, they use it, the tick goes away, and then it ebbs and flows in that way, but they're able to deal with it much quicker and efficiently after they have CBIT training. So I'm going to have some of the kids talk about their outcomes, which are good, and then there will be references, and then just 2 shorter videos of a couple of kids who have really been helped by their CBIT and very cute, and then we'll have some Q&A time. Thank you.
CBIT has helped me get overcome my tics because I used to do this and now I do this, and so it's kind of helped me like stop doing it more, and that people can't really notice it anymore.
It has changed him for the better, a lot better. Before we found CBIT, we had a lot of emotional issues over the summer with Caden, with his vocal tics and his motor tics, and me and his father just not understanding them and not really knowing how to help him. And then once we came here, we were all able to learn together on what exactly he needs to do and what we need to do at home to help him. And it has changed our entire family's life for the better. And Caden has now eliminated several different tics, and he continues to work on certain ones throughout every week that we get to come here.
I used to have 25 tics, and now I have 11.
We've also noticed that the consistency and frequency of the tics has clearly gone down as well. It's not just the number of them, but the frequency of them.
CBIT has changed my daughter in that it has taught her that she can control her tics and anxious behaviors. It has given her tools such as fidgets and other things, replacement behaviors and things that we can do that we can implement into our lives in all different settings.
And I do belly breaths to help counter out them. And for other tics that aren't vocal like this, I have this tapping tic where I can tap some things. Sometimes that tic goes to like the back of my head. I can catch it with volleyball that goes like this, kind of like this. After having CBIT, my tics are getting better. I have Tourette's, or tics you may call them, but I also have a few other things like ADHD and a little bit of anxiety. My ADHD is basically it's not like a bad thing. It's just I can get really carried away very easily. And with my anxiety, it's kind of hard to explain. It's just what you expect that anxiety to be. You also have a step up in my brain where I'm like naturally gifted, but it can be a bit stressful sometimes. But I know one day I will use this brain for an amazing talent that could be.
I want to thank everyone for listening. I will continue to answer questions in the chat box as I have done throughout the recording until our time is up. Have a wonderful day. Bye.